We did a study kind of looking at how obesity and other metabolic factors affect nerves to the feet, nerves in the brain, and also potentially nerves to the eye for the retina and the kidney. And what we found was that central obesity, the obesity around your midsection, is really important for not only the nerves that go to your feet, but also the nerves that go to your brain. And these don't affect the nerves to your eye, the retina, or the kidney, at least not nearly as much. The BMI, or the global obesity, wasn't any different between those people with and without neuropathy. It was really where they put the fat in the center part of their body. And like you said, some people are prone to putting fat in their abdomen, that central area, and some put it more in the thighs, in different parts of their body, which is not as bad. But as far as trying to come up with interventions that might lead people to put fat in the right place, we don't know how to do that. Some people with neuropathy have pain and some have no pain, both of which can be problematic. We know when there's pain, it affects people's quality of life, and then we concentrate on trying to treat that pain. But painless neuropathy is also bad because people don't have the protective sensations of pain. So they might step on something or hurt themselves and not know it. And that can lead to ulcers, infections, and amputations even in the worst case scenario. So it turns out pain is a very important part of our ability to protect our feet. And so painless neuropathy and painful neuropathy are both important. The two ways we approach people with neuropathy is one is trying to prevent it from getting worse by addressing the underlying factors like obesity or diabetes. But the other thing would be treating pain if people have painful neuropathy, which a good proportion of people do. And we have 3 classes of medicines that help for pain, none of which are great. They all work, none of them are amazing. All of them have some side effects. So we definitely need new medicines. But we also have 3 available classes that are effective. So we put them through a whole cognitive battery called the NIH Toolbox, where they have to do all sorts of different tests that look at how all your different parts of your brain function. And what we found was that all these tests, when added together, are not quite as good as people that don't have obesity. So it's not that they're frankly demented or having severe problems, but there are subtle changes in the brain, even in this relatively young group of people. That's something that we're trying to figure out right now. We have an ongoing study looking at how much exercise is helpful and how much weight loss is helpful, from at least surgical weight loss. We've had previous studies looking at medical weight loss. And so, we think exercise and weight loss are one or both are the key, but we still haven't definitively answered that question. Yeah, we're super excited about trying to tease out the relative importance of weight loss and exercise. Both are life-altering interventions, so doing both is obviously very difficult. And if we knew which one was more important, or at least for nerves in the brain and in the feet, we think that would be very important. And then it's trying to figure out, if it's exercise, what is the best type of exercise, how often? And we're looking at high-intensity interval training, but is it more conventional aerobic training? Is it resistance training? So a lot of unanswered questions as we try to tease out the benefits of exercise and weight loss and the combination thereof.